Noisy activities are part of everyday life for many people. Examples include everything from working on a construction site to playing music too loudly over headphones. But did you know that taking care of your hearing can promote brain health as you age? Here's what you need to know. Communicating, perceiving the world, listening to our loved ones, detecting changes around us, or relaxing to mellow music are all activities that involve hearing. Hearing is a complex mechanism whereby sound signals such as speech, music, or environmental sounds are received by the ears and then interpreted by the brain. When the ears transmit information, various parts of the brain are activated to decode and analyze the message. For example, during a conversation, cognitive processes such as language, memory, and attention are set in motion. According to recent global data, hearing loss accounts for 8% of all neurocognitive disorder cases, such as Alzheimer's disease. The link between hearing loss and neurocognitive impairment is not yet fully understood, but scientists do have a few explanations. One theory is that hearing loss may be associated with changes in the brain. More specifically, the parts responsible for hearing may atrophy due to lack of use and function less efficiently in people with hearing loss. Another theory is that difficulty hearing causes some people to reduce their social interactions. This is to avoid frustrating or unpleasant situations resulting from that hearing loss. Unfortunately, fewer interactions with others also means less intellectual stimulation, which could lead to cognitive decline. Our ears, like our eyes, can decline as we age. It's actually a common problem for older people. These changes often occur in the inner ear. The inner ear contains the cochlea, which is the main structure involved in hearing. The cochlea is lined with hair cells called cilia. The sound signals that enter the ear are converted by the cilia into a message that the brain recognizes, like speech or music, for example. As the hair cells become damaged with age, the messages sent to the brain are disrupted. This can make it harder for the brain to decode and analyze the information it receives. Other common causes of hearing loss include genetics, chronic ear infections like otitis, or repeated prolonged exposure to loud sounds or noisy environments. If you spend lots of time in loud, noisy environments, you should protect your ears with earplugs or earmuffs. Another wise choice is to take quiet breaks before and after exposure to noise. Now, how do we determine that an environment is noisy? As soon as you start to feel that it's noisy, it usually is. But if you have to raise your voice to be heard, now that's a sure sign that your environment is too loud. Exposure to noise over 85 decibels for more than 8 hours a day can cause hearing damage over the long term. Sounds above 85 decibels roughly correspond to an alarm clock, lawnmower, snowblower, a noisy restaurant, or passing a diesel truck. Hearing tests should be as routine as vision tests, particularly after the age of 50, so that any hearing loss can be resolved quickly. The tests can be conducted by an audiologist. Some of the early signs of hearing loss to look out for are the impression that people are mumbling or murmuring, tinnitus or ringing in the ears, such as whistling or buzzing in the absence of real noise, a feeling of blocked ears, trouble hearing high-pitched sounds like birds singing, for example, difficulty following group conversations in noisy places, frequently asking others to repeat themselves, or turning up the volume on the TV or other devices to hear clearly. Treating hearing loss at any age can help prevent or delay cognitive decline.